We did a show a few months ago together where we talked about how addiction was not your identity. And I thought this month, with the mental health awareness, we will try to understand a little bit more. Like a lot of people think the problem is you're an addict and that's why you end up in jail. But addiction, it might just be a survival strategy, for a whole bunch of, society failures or, physiological issues, experiences. So today I thought we'd talk about how trauma and addiction are related to each other and why healing can begin long before substance ever even happens, so that we don't go down that rabbit hole before it's out of control. Because the reality is, and since you're in the system, the services that people really need are not always accessible. So it's we're doing the best we can to provide help in a compassionate way. And, I think you, especially as long as you're protecting yourself from burnout, myself the same in nursing, how do you feel? We're not judging these people. And because that would be like judging ourselves, like I said, we're all one step apart from, we maybe have made different choices than some of the clients that you work with. But sometimes you can't get the help you need unless you accept labels. That's a function of the way I think our insurance system works. What is your understanding about, where does, how does trauma lead to addiction?